This is data analysis for chronic health conditions, a tool to promote the academic success of students with chronic disease. The National Association of School Nurses initiative encourages school nurses across the country to participate in creating a national school health data set that will influence local, state, and national student health policies, as well as identify best practices for managing chronic disease in school. On behalf of Project Switch, welcome to the training on data analysis for school nurses. Project Switch, Strengthening Wellness and Improving Teachers and Children's Health, is a one-year supplemental grant from the Center for Disease Control. As schools switch gears to meet the challenges of COVID, the purpose of this project is to provide training and assistance to schools on the implementation of the CDC's COVID-19 school-based guidance in the areas of physical activity, chronic disease, social-emotional climate, nutrition services, and supporting high-risk vulnerable populations. My name is Beverly Burke. I am president of the School Nurse Organization of Oklahoma, and I am the Project Switch's school nurse cadre leader. I'm excited to work with nurses from across the state to identify the needs of managing chronic health diseases in schools and to develop chronic community partnerships to meet those needs. I believe we can achieve more by collaborating with each other. Together, we can improve the quality of school-based health services. As a result of this presentation, learners will be able to correlate how data collection can impact the goal of managing chronic disease in schools. They'll be able to identify strategies to collect data, analyze data to identify trends, utilize community partners to address gaps in the healthcare found through data collection, and plan to present school health data to district, community, tribal, and national supporters. In light of COVID-19, it is important that school health practices are consistent and equitable across the state. The first step in identifying best practice is data collection. As school nurses, we need fast, easy, and meaningful data collection tools. So data collection in schools is already happening. We are submitting information on the city population, student-teacher ratios, and free and reduced lunch. And that type of data helps provide funding for schools and districts across the country. In addition, Oklahoma School Health Services are required to collect data regarding immunizations, vision screenings, and absences. It's easy to see why that type of data applies to educational success. Healthy students learn better. Students who see well learn better, and students who attend school regularly learn better. Data collection is the first step to identifying and promoting academic success. One study revealed that when students left the classroom to seek nursing care more than 4 times per year, they were more at risk for low academic performance and lower test scores. Data collection helps set health goals in school communities, and it keeps students with chronic conditions in school and learning effectively. Data collection investigates the need and/or informs others about the need for more support in the area of school health. And it's useful in communicating with school boards, principals, and supervisors about issues in school health. So where do I start? When I listen to school nurses talk about data collection, the first conversation is usually, how do I do that and take care of students and take care of staff and run programs in my community? And the answer is, start small. Start where you're already spending your time. Start where you have students that are coming into the clinic that you're taking time to administer nursing care, such as students with 504s or IHPs, students with chronic diseases like diabetes and seizures, asthma and sickle cell. They leave their room more frequently than students without chronic disease. Think about their academic progress, and is it changing with COVID? And what community health issues are you seeing at this time? As nurses, we know that if nursing care is not documented, it isn't considered given. So where do you currently document healthcare that's delivered by any person in your school now? Data records come in all forms. Wherever you're currently writing down your notes, that's where your data collection starts. Common places include a notebook or a flow sheet, an Excel spreadsheet, and even an electronic health records. Now, note that most school nursing documentation is protected under FERPA and if you're associated with an external medical group like telehealth, it's important that they will be compliant with HIPAA as well. Be sure to discuss with your administrator the guidelines for providing access and storage of nursing records in your school. Each district has different processes for managing confidential record storage. Remember, actual data trends will be summarized from your nurse's notes and will not be specific to students or staff. Once you've identified where your notes are and how you're documenting, then you can begin to look at the quality of those notes. Can you tell at a glance by looking at your notes how many students came and what the outcome of the care was? If not, you might consider updating your daily forms to make your statistic counting easier. Some ideas with that would be to add columns to reflect the items you want to count, or to use a color-coded system for the items that you want to count. That way you can do data collection very quickly. Most nurses find that they can accomplish their daily data counts in about 2 to 5 minutes if their nurses' notes are formatted to show the goal that they want to track. Also, if you have electronic health charting, it is important to be able to run the reports and get all the data that electronic records can offer you. If you aren't, it is worth the time to learn to use your electronic health reports if they're available to you. In this slide, I'm showing you a sample of some handwritten clinic daily logs. This is a place where you'll be handwriting daily notes. And I've shown you a couple of things that I've done to make it easy to count. One is on the time in and out column, I can determine how long visits are staying in the clinic. I can determine at a glance if they've been sent back to class or sent home, or if they were referred or had an accident. And notice that I've added a chronic condition column so that I can determine at a glance the students who had chronic conditions, and a communication column called the telephone calls, but basically it's communication so that I can record how many times I'm communicating with people outside the nurse's office or the school. With this type of charting, I can see very clearly that in this example, out of 13 visits, 5 of those students had chronic illnesses, and 4 of them were returned to class. Now, I could even take that a step farther and say how much time those 4 students spent in the classroom. This is very powerful data. When you look at your logs, it's not going to be possible to identify every potential issue that you could identify. That would get very overwhelming. You're going to pick or choose 1 or maybe 2 areas that you feel passionate about helping in your community and in your schools. From your daily log, you're going to want to do a sample weekly log sheet. Now, notice that in this left-hand column, I've included all the things that my EHR system can count for me really quickly. If you are not using an EHR, then you would put just 1 or 2 things in your column, and you would just be counting those items and putting in the data from Monday through Friday into your weekly logs. You can see that with numbers, data adds up very quickly. In the weekly log with all the numbers of students and visits and things that the nurse has been doing is a powerful tool to present to your supervisors and board members. From the weekly log, you're going to then do a monthly total, and that will serve as a semester count for the first semester, and then allow you to look at and analyze trends at that time. Numbers become very powerful at this point because you can start to compare one month to the other, and you can start to compare trends, if it's going up or down, or if it's all over the place. In this example that I'm showing you here, in September, we had the highest visits ever for the semester, but it wasn't until November that we had the most referrals out for more medical care or more health care, when the actual visit numbers were down a little bit. So you kind of ask why? What's the trend with that? Well, I bet any of the experienced school nurses out there can probably tell me that in September, ragweed started, and those kids were miserable, but they didn't have to go to the doctor. And then by November, flu was already in full force. We were seeing it start, and we were sending out for medical referrals. But you have, by having these monthly log sheets, you have that data that you can actually prove what we think we know. From the monthly log sheet, then we're going to do an annual log. Now this is where the numbers really add up. And again, remember, on my log, I'm measuring lots of things. I'm not only measuring student numbers, but I'm measuring specific types of numbers. But in your log, it's just as powerful if you have one or two data points that you're measuring. Those numbers will really become clear and will really reflect areas that you want to make a difference in. Now, in this example, notice that out of 132,000 visits, 10,400 were for asthma care. That's approximately 8% of the student population seeking care in the nurse's office or in the school health clinic for a chronic illness. Now, we could take that even further again and notice how many of those were able to go back to class because we were able to give medication, and how many of those were being sent out. But we can first start by saying that means 8% of the time of the health clinic is spent in managing asthma care. And it means that is a high volume in chronic health and chronic disease management. So again, you see where the numbers really can start to jump out at you when you put them all down over a semester. Now, if you don't have a electronic health record, or you don't exactly know how to start data collection, a good place to think about starting would be with the National Association of School Nurses data set. This is an Excel spreadsheet that you can download. And basically, it's a weekly spreadsheet that you put your numbers into, and it does all the adding and additions for you. And it basically is looking at the number of student visits and how many of those go back to class, how many of those are called 911, and how many of those are sent home to a caregiver. This is valuable information worthy of your consideration to justify the presence of or absence of a school nurse. And it's also really valuable in justifying to our national organization the information that they need to lobby for school nurses in school districts across the country. Now, if you've got data in weekly logs and monthly logs and semester logs, and you've been tracking that data and you're collecting it, the next thing is to begin to analyze your data and to start to form some goals. If you notice that 20% of your chronic asthma students are being sent home for asthma in the first semester, then you can start to ask why. Why are they leaving school instead of going back to class quickly? Well, do they not have medicine at school? Do they not have a primary care physician? Is there no transportation to get a refill on the inhalers? Were there specific environmental triggers during last semester? Were there fires in the community or high degree amount of rain and mold? And even something to think about in the presence of COVID is, was the anxiety high, or was there community trauma? And looking at why, you might come up with a theory. You might not know the answer to that, but you might come up with a theory based on the 20% of kids that you were taking care of. And you could set an intervention then to reduce that number for second semester. Even if we reduce that number to 20%, from 20% to 10%, that's a significant amount of time that those chronic kids are back to the classroom and continued with their learning as opposed to being sent home. The other idea is to identify and consult with community partners to address gaps in healthcare. So if they don't have primary care physicians, perhaps we could look at telehealth for those kids. Or if they don't have medicine at school, maybe we could look at programs that will help them get their medicine. And even American Lung Association has a great environmental trigger program that they'll go to the home and do a free asthma education and provide everything from air filters to mattress covers. And we could get started with using their partnership as well. So looking at your trends, analyzing numbers of the things you're interested in, setting a goal, and then getting to your community health partners to address those gaps in care. That's the process. Now, this slide is just an eye-catching slide that provides an example of how school nurses prepare students to be successful in schools. If you're tracking data and developing partners and impacting school and your community, you want to be able to share that with your supervisor and administrators and school board members. And if over 30,000 students are being screened and we're helping them achieve what they need in life, glasses and hearing aids and life-saving medications, then we are helping them to improve their academic status as well. Now, if you have a good handle on tracking and presenting school health data, and remember, it doesn't have to be pages of data. One data indicator is very helpful. Then start to offer help to other school nurses who are just getting started. I think the hardest part about collecting school health data is just getting started because it feels overwhelming and it feels like you don't know how to do it by yourself. So make an offer, reach out to people who don't have a process yet and help them. And if you are able to collect data and participate, then consider making sure that you are sending your information to the National Association of School Nurses to impact data across the country. What you do there is you download that NASN worksheet that I showed you before, and there's a link here, and then send your numbers at the end of the school year in May or early June, whenever you finish school. Send your numbers to nurseanew@gmail.com or gailb@health.ok.gov. And what happens is they put all of our school numbers from all across the state into a statewide report that then gets submitted to NASN, and from there they make a national report. In conclusion, data collection presents essential evidence that school-based health services are an effective strategy to improve chronic absenteeism, are a prudent investment in the health and the academic success of school-age students, and are a technique to identify gaps in health services and to develop community partnerships. This slide is a link to a presentation that was done by our partners in Texas. And this is a smaller school district who utilized their data collection to present a PowerPoint of the activities and present it to their community so that others would know about school nursing. I'm going to leave the link there, and it will be at the end for your review as well. It's 2 minutes long. I hope you'll take that 2 minutes and review that. This next slide is just a list of resources that I used in compiling for this presentation. And if you have want to go back and download any of those sample forms or see any more about the research I cited, here are the links for that. This is a disclaimer that's just to remind you that data collecting is not a requirement in the state of Oklahoma. However, this training acknowledges the benefits of data collection and identifies data collection as a best practice in managing health conditions. This slide is a certificate of attendance. You will be able to use the link at the end of this presentation once all of your evaluation and requirements are met to download a certificate of attendance for your professional development uses. And don't forget to complete the evaluation at the end of this program. It is very helpful for us to have your views and feedback. And then last, if you have any questions or concerns, or if you'd like some personal assistance in developing your data collection or assisting others with data collection, please reach out to me and to the other school nurse cadre members. We are here to work with the state of Oklahoma so that we can do the best that we can in managing health conditions and addressing the gaps in chronic health. I wish you the very best of success in your data collection